It's a great honor for me to be here to introduce the new rotary system, the Aurora amplifiers, a gift for other dentists. This is our lately development. So it's very honored for me to participate in the design of the file. So it's a great pleasure to introduce this new gift for all of you guys. Okay, what is a definition of ideal amplifier? What is a good amplifier? Different dentists always have a different answer. So when we face a market, maybe a lot of persons will give you a different answer. First of all, it should be very simple and safe. Everybody should understand that it must be simple. It means it won't change our users. Everybody uses it every day, and you don't need to learn for it for a long time. You can simply handle it. The second one is an excellent fatigue resistant, and then smooth and effortless feedback, and also to meet the needs of dentists at different stages, and a nice corner fit. So on the market, we always have three different level dentists operating the root canal therapy. The first of all is the beginners, and then experienced general practitioner, and also for those experts. Okay, for beginners, what the consider of them, what they worry about. For other beginners, they worried a lot about the instrument separation, the ledge occurs, and also the strong suction force, which means it will over preparation of the root canal and cause a series of problems. First of all, this is the advantage of Aurora. This is a curved canal, almost a U-shaped canal, that we put the file into this model to keep it rotating, and then calculate the time when it will separate. This is other manufacturers on the right side, and this is Aurora. We notice that for other manufacturers, the break-in time is about 2 minutes. Okay, to break. But for Aurora, almost three times, about 6 minutes, it's still rotating at such a very severe curvature. Very, very safe. And why this happens? It's how we manage this. This is under the microscope. Just look at the surface of different files. For other manufacturers, you can see a lot of little breaks or some rough on the surfaces. This is why force will accumulate and then break down. But for Aurora, much more smoother surface we have on this file. It's excellent surface treatment. And the tip of the files is another trick. Why it is safe and nice. This is a tip of an Aurora file. You can notice that it's very smooth and just connected to the cutting edge. But for other manufacturers, they always have a danger cutting tip. A cutting tip, okay, it will increase the efficiency of the file, but also causes a lot of ledge occurs. Okay, this is Aurora, this is other manufacturers. We can notice that the beautiful and the smooth from the tip to the cutting edge. This is a cutting tip. When you use a cutting tip on the canal, it will or sometimes occur a ledge there. And for Aurora, it's a non-cutting tip. This is an experiment that very smoothly goes down to the end of the tip to the end. Okay, and also we do a little bit a reduction of the suction force design. That means when you use this, especially number 25 around this number 25 file, a strong sucking force will, for a new beginner, will push the file down out of the foramen. Some of the dentists will be frightened and also cause the severe after treatment pain and the odontic appointment pain for the patients. For the Aurora, okay, The suction force is not too large nor too little. If it is too little, you have to push it to the end. You have to push, push, push. Sometimes you break the vial. If it is too large, sometimes it will cause us over preparation. But for Aurora, we have a perfect feedback for other beginners. It's to protect the dentist, it protect the patients. Good. So for beginners, they're afraid of the broken of a file, the separation. But the fatigue resistance is extremely awesome. And that for ledge, the design of the tip is not easy to occur. And also for over preparation, have a perfect hand feedback for those beginners. And for experienced GP, what's the problem they met every day? Sometimes what they complain about. For experienced GP, a curved canal, as every day maybe they will face or every week, sometimes the file won't go down to the tip. It's counterclockwise, and not that easy to get into the end of the canal. And the corn fat is a problem, and also the extreme condition, the patient with a limited mouth opening, they might face. It's very, very hard and extremely hard for them. And on the market, we usually talk to our dentist. You want a soft file or a hard file? Maybe 9 out of 10 will answer they want a soft file because the hard file can't fit a curved canal. They are not that easy to get in down. They face a lot of problems. Okay, but the truth is the heat treated end of files, yes, of course, they'll become very soft. But within this, all the endo files, just look at it. They have two sort of metals inside of an endo file. The first of all is called the martensite, and another is called the austenite. For these two different metals within at the same time in a endo file, the martensite is very, very soft. It can fit the curved canal, and for austenite, no, it's not that soft. It's a very hard one. They will transfer at some conditions. What is the condition of the transfer condition? The temperature. Especially within the body temperature, to look at the austenite started at about 35 degrees centigrade, and the file is very soft outside the body. But when they put inside of the canal, it suddenly becomes very, very hard. This is why we can pre-curve, we can use this file as a very soft one outside the body, but within the body, they become very hard and not easy to getting down. But for Aurora, the austenite finish temperature is over 40 degrees centigrade. That means even within the canal, the dentist will also operating on a very soft one, unless your patient's getting a fever or a high fever. Okay, so why rotary files are unable to reach the apex? Another secret hidden on the design is the change of the volume. That means when you use the first file, then you use the second file. What it is increasing of the volume. So this is for four different brands and files in the market. Let's just look at this is a change of the volume. You can notice that this is Aurora. This is a different other manufacturers. For other manufacturers, especially this one, 2506, a lot of the dentist complaints, when they come to the tip, it will dee counterclockwise, and the dee counterclockwise again. A lot of dentists, why? It doesn't work. And for Aurora, no, it's a fire. Almost no counterclockwise. Later I will show you a small case of mine. Because the change of the volume is not too large. It's very comfortable for other dentists or the other GPs. Okay, please play the video. This is a small little case that I operated several days ago. This is number 25 tooth. It was refers to me because this tooth is quite curved. Just notice that it's an S-shaped severe curve canal. We notice it's quite curving. It's a double curvature. We do the root canal for this curved tooth. This is the preparation of the pre-build up and the caries removal. And then we do the negotiation. Of course, it's quite a curve. So we started from number 6 and file. And then number 8 and number 10. We don't need to use number 15 because the first pacifier of the aurora is number 12. It can perfectly just fit number 10. So we use a little bit ultra clean and aurora and my motor. This is number 12 pacifier. You notice that it's very easily to getting down. Just 3 to 5 stroke. It's getting to the end of the canal. Of course, you can do a lot of brushing. It's very safe. And number 17. We irrigate with our trickling. Whoops. A little bit brushing. Very fast. Seems like totally no resistance. Number, this is a yellowish one. Number 25. Because it's a parabolic, so we finish at number 30. It's the file of number 30. You won't see any counterclockwise, any out of the torture resistance. And very easy and fast to go to the end. And the core fit was perfect. You can use warm gutta percha. Also can use single core technique. No matter, just up to you. So we use a lot of, this is surfy one. It has sonic activation. Do the obturation. This is just the finish. Okay, very easy one. With the help of Aurora, I finished this case within 20 minutes. Extremely fast. And the patient is very, very happy because the time is very short, no pain at all. And I'm happy, my nurse is happy, everybody's happy. Okay, so for experienced GP, a GP also face they are the majority person on the market. They face a lot of problems, like within a curved canal, they can getting down. But for Aurora, it's heat treated and taper design because it's very easy to reach the end. And the corn fit, okay, the Aurora is 0.2 millimeters. And the extreme condition, causes can pre-curve. Within some patients with small opening of the mouth, you can pre-curve them and put it directly inside of the canal and do the preparation. And also for experts, well, the consideration of the experts was a little bit different. And the experts consider it should be minimally invasive. That means we don't want to after preparation, the root get fractured. There's no transportation at all, and also some calcified canal. Okay, So there's a one consider how large we have to prepare the canal is. For different places around the world, the answer is quite different. Okay, this is the experiment of the fracture resistance of the prepared rotary instrument prepared tooth. This is an instrumented preparation. The reduction of the resistance is 0. And for 2005, its resistance reduction becomes 7.3. Let's look at it. Number 55 and 05. Okay, it decreased 31.2. That is too large. It means the root is going to fracture. And interesting thing is, we increase the taper, not the size of it. It's double increased as the taper was double increased. So the answer is, now we strongly recommendation as smaller taper, larger size. It's more reasonable. So just look at the package of the Aurora. The 2505 is okay. 2506, yes, of course, we can do it. And 3004, 3504, 4004, and over 40, it's 5003 and 6002. That means on the RA face of the canal, the size is around 80. It's not too large, but large enough. Because this place we call it pericervical denting. We pre too much, we cause the fracture of the tooth. It's very conservative and a very good one. After the preparation, you can do warm gut aperture, you can do single core technique. The core fit is perfect, no problem. And also for the taper feedback. Taper of the first pacifier is 04. That means the cross section is relatively a little bit thinner. When we face a curved or also a calcified canal, you can do a little bit of stroking motion. A picking motion that also have a perfect hand feedback. Sometimes allow the fire to into very smaller spaces to get to the end. And also for experts preparation. Okay, so for experts, we present a file, minimally invasive, no transportation at all because of the temperature, the heat treatment, and also the calcified canal. Sometimes you can do a little bit pushing, a little bit, it's okay. And it will help you a lot. For me, a brand on the market, a good thing on the market, it's not something we tell our customers to do, to let them feel. A beginner can benefit a lot from this file. A GP can benefit a lot from the file. Also, an expert will feel welcomed by the file. Everybody can sense the advantage of the file. So this is why we are proud of it. The Aurora, the best of us. Okay, so this is a gift for our dentists. I hope all of you and all your dentists will enjoy it. Thank you.